Today, we'll dive into three important vascular conditions: Raynauds Disease, Superficial Thrombophlebitis, and Varicose Veins. Let us explore their causes, symptoms, examination findings, and treatment. Raynauds Disease is a condition where the blood vessels in certain parts of the body, like the fingers, constrict excessively in response to cold or stress. It is most commonly seen in young females. In cold weather, affected individuals notice their fingers turning pale, followed by a bluish tint, and finally redness as blood flow returns. This sequence reflects the restricted blood supply and its subsequent recovery. It becomes pale due to the initial vasoconstriction of the vessels, lowering the blood supply to the skin. Then it turns to blue, which is a transient or brief cyanosis interval in the skin from the reduced hemoglobin. Then it ends up being red, which happens upon rewarming or relaxation. The skin can flush red as blood flow increases and oxygenated blood returns to the area. On examination, the pulse remains intact, distinguishing Raynaud's disease from more severe vascular conditions. Treatment includes general instructions like avoiding cold exposure and wearing gloves. Specific medications include vasodilators such as Trental 400 mg, which is taken every 12 hours for 2 months, baby aspirin or small dosed aspirin to reduce blood clot risks 75 mg once daily, calcium channel blockers to relax blood vessels, which is Adalat 30 mg once daily on an empty stomach, also known as nifedipine. Patients should be instructed to treat coexisting conditions if present, such as controlling blood glucose if diabetic, restoring hemoglobin if anemic, prevention of smoking, and cold exposure to prevent worsening of the case. Now let's discuss superficial thrombophlebitis, a condition involving inflammation of a superficial vein, often due to intravenous cannula insertion or injury. Patients often present with pain and swelling over the affected vein. In some cases, there may be fever as well. Examination reveals redness and swelling over the vein, which may feel firm and cord-like upon palpation. Treatment options for superficial thrombophlebitis include rest and bandage the area with hot fomentations to increase the immune system response towards the area, analgesics for the pain like non-steroidal anti-inflammatory drugs, for example, Cataflam 50 mg given 3 times daily. Antibiotics like Augmentin 1 gram tablets twice daily for 1 week. Now let's discuss varicose veins. Dilated, elongated, tortuous veins that irritate the patient, which can be primary, which most commonly is familial and genetically inherited, or secondary due to a pathological cause. The patient complains of the cosmetic appearance with associated aching, discomfort, and night cramps that increase while standing and decrease while laying supine. It can be associated with mild swelling and other skin manifestations that include long-term varicose veins, which include pigmentation, ulceration, and bleeding, which will be later discussed. The patient's leg will have visible vein, dilated tortuous veins, and will order Doppler or duplex ultrasound in order to check the patency of the veins and the flow of blood inside them. Treatment of the early non-complicated cases include giving general instruction to the patients and medical treatment concerning the patient. General instructions include standing for a prolonged period of time should be prohibited. If the patient is obese, he should aim to lower his weight. Wear elastic stockings, wearing it in the morning after sleep and taking it off before sleep. Elevate the leg during sleep to decrease swelling and pain. Medically, we use venotonics to decrease venous congestion like Daflon 500 mg twice with food for 6 months, Riparo ointment as an anti-inflammatory, anti-edematous, and analgesic ointment.